I hope everyone's moved in. So, welcome to the afternoon session. My name is Jan Geisler. I'm the director of the project and working for the European Patients Forum. We had very good discussions over in the last breakout groups. But before we go into that, just a housekeeping issue. One of our delegates has lost his pillbox with important medication. So if you find it somewhere, it's a small pillbox with this morning, afternoon, evening pills. Please return it to the registration desk. It must be somewhere here, so please help us on that. Okay, going into breakouts. I mean, we have a challenge because we are already 10 minutes late because we know the groups were going a bit longer because we had very good discussions. And we have 4 reporting backs from the breakout groups in just 45 minutes. So it's a bit of a challenge, but we don't want to lose the opportunity to give everyone the impression what was actually discussed during the breakouts. And that's why I'm not going to talk for long. We've been discussing all the different scenarios of having EUPATI, how can we drive forward EUPATI in countries where the national platforms exist, in the countries where no ENP exists, like in Germany. It was quite an embarrassing discussion for my home country, I must say. How it works in countries which we are not targeting at the moment with EUPATI, and then also talking about the longer term and sustainability. So as a first rapporteur, I would like to introduce Karin Holm, who was actually a rapporteur for Breakout Group 1, making it work nationally for countries where EUPATI national platform exists. So Karin, well, you're coming there. So stage is almost yours. Thank you.
Thank you, Jan. Okay, yes, we had a very vibrant discussion. How do I turn?
I think you need to go there.
I need to go there. Okay, sorry. So we were talking about countries where there already is a national platform set up or forming, and how to make it work nationally. So the group was considering what are some of the benefits of having a national platform. And early on, someone said, I don't like the word platform. A lot of other people agreed. And so we kind of referred to it sometimes as a network. The platform word just didn't resonate well with some people. But the groups that already have a network set up, they found that it can be a central point for questions on national health policy and decision-making groups, such as the Medicines Agency in the country. They would be able to turn to the EUPATI group with questions. It's a way to bring a diverse group of national partners to speak with one voice, communicating a united message about the importance of patient involvement. And the network can also connect the dots between the different individuals and organizations who are interested in patient involvement. A national platform or network gives the perception that it is possible to have multi-sectoral cooperation between patient organizations, academics, research, government, and pharmaceutical industry. And it also creates one group to address these key issues across the nation. There was also a mention that you could get funders together, coalesced under at one table. So we asked the group, what are some of the national partners? What could their contributions be? Of course, we know these, but some of them are worth listing again. All interested patients, whether or not they are part of a patient organization. That could be a way that they get into a patient organization. Italy said they had over 9,000 patient organizations, so we all can cast our nets wider to invite groups into the fold. We can reach out more to academic and research institutions, clinical trial organizations, to get their strategic thinking, teaching, partnering in disseminating the information. Ministry of Health, other national institutions like the regulatory authorities, institutes of health can provide funding and strategic support. And there's also an idea of going to the healthcare professional associations and getting their buy-in and involvement. Ethics committees, both at the institutional review committee level within hospitals or within jurisdictions, if the countries have a geographic ethical review committee. Pharmaceutical associations or numerous pharmaceutical companies, you could get involved. You probably don't want to have just focus on one, but also going to the media and getting journalists involved for communicating. And we ask, what are the strategic priorities then for forming this group? You know, I must say that while people were giving suggestions, there were also a lot of questions still. In our group, there were a lot of people that were here for the first time, so they were asking questions, but from the questions came some answers as well. A big priority people mentioned were passing on the knowledge of the EUPATI trainees to the wider audience, multiplier effect. They spent this intense time learning, and how are they going to pass on that knowledge so that it gets spread to a wider group? And then figuring out how to bring together the different players, some of the partnerships that have been started within the country, how to strengthen those partnerships. And then how to communicate the existence of these new tools, the toolkit coming online later this year, linking up the players and broadcasting the message widely. And then there are a lot of questions about what will be the governance and operating structure of this platform or network at the country level. So what will success look like in a country? Well, that people are aware of each other, because in some cases still it's very new, and people within a country may not even, this may be your first experience here at EUPATI. So if we need to get the word out, and that's one measure of success. Getting all the partners on board in whatever way works in your country. We talked about memorandums of understanding, worked in Italy. If you can get institutional buy-in, support. And then looking to secure funds for what happens after 2017 and trying to find them in a sustainable manner. That's something that Switzerland is thinking about a lot now too. So success looks like doors opening, new avenues, new ways of thinking outside the box. And if the national platform or network becomes the go-to institution for questions on patient empowerment, we know that we've done our job. Another question was, what do the national platforms, networks have in common? Well, we each have the task of trying to figure out how to build relationships, strategic partnerships, and networks. And we have to decide in our country, what is our main role? Are we the router? Are we routing things? Doer? Are we the ones who are doing training, doing dissemination of information? Are we the signposter, just putting up the sign, communicating? Or are we a portal for further work? There was a suggestion that case studies to learn from each other would be very helpful. The countries that are ahead of the game already, Italy, Spain, Ireland, for example. And we talked about how, remember that each partner has their own partners and affiliates, that there could be a multiplier effect to spread the word within an organization in different countries. And then some issues are country-specific. There was a mention of the health technology assessment process, could be unique to each country, but certainly there are at least more than one that you can learn from. And through this networking, there's an informal forum to share ideas and materials.
Super, thank you so much, Karen. I think we don't have time for questions before we see that we get through in time, so I would probably like to invite you to stay here, and if we have time at the very end, you can raise them to the whole panel of the 4 breakout groups. So thank you so much for that. As the second rapporteur, I'd like to introduce Sue Pavitt from the University of Leeds. which was the group I attended as well. And it was about making it work nationally for countries where no national platform has been established so far. So Sue, thank you so much.
In fact, I was so enthusiastic, I introduced myself as Sue EUPATI instead of Sue Plavitt, so, which was much amusement on that, wasn't there? I can't remember my own name now. So our objective really was to look at what steps the NLTs needed to take to get the EMPs, the platforms, effectively established within their country. And we did a quick cast of votes, and in our group we had about half people who had already achieved this and half the people who haven't achieved it yet. So we were able to try and provide some knowledge transfer from those that had. So our first question was, what may be some of the considerations in setting up an EMP and what may be some of the obstacles? So we had spent most of our time discussing the obstacles in the session. But we agreed with some of the earlier sessions from Italy this morning that we need to find the drivers, the natural leaders, those that have a vision and are able to enthuse that to other people and bring them on board. And an example was Mike Griffiths, who enabled EUPATI to be set up as a patient-led organisation in Ireland, but he was able to achieve senior buy-in from the heads of medical schools, industry and patient organisations, and that they were able to truly develop a tripartite relationship. So we know it's achievable. Finding the right champions is challenging, and we're looking for people that can provide the right knowledge, resources. Sometimes that's in kind with people that they can bring admin support, infrastructures, contact bases, and access to influence spheres. In academia, there was talk about bringing more clinicians on board, not just academics, and trying to find the benefits of the clinical trial design and engaging with patients within those organisations. Finding the right people in pharma has been very challenging, and navigating these big companies when the right hand doesn't know what the left hand's doing, or they already have somebody but they have no idea that they're doing it within these huge organisations. And so the idea was perhaps that we might be able to tap into those that are already engaged with EUPATI and identify some of the champions within the companies that have already been identified. We spent quite a bit of time discussing the German and Austrian perspectives because they have real angst in terms of engaging with pharmaceutical companies. And on a positive note, we thought that perhaps what we needed to do is keep your enemies close and learn so that you can start to break down some of those barriers. And that remembering really that pharmacy does develop new medicines and we all need them. So we do need to work on getting greater transparency and building bridges there. So we then moved on to look at what the ideal platform would look like and who the stakeholders might be. And so obviously we were reminded it needs to be a patient-led platform, and that we needed to create good partnerships between the patient organisations, academia, industry and other parties that wanted to join. Some of the other stakeholders that can be useful in that process are also the media, which brings an ability to snowball and gain momentum and wider coverage of our shared vision and goals. We talked about some of the examples in the UK of the government funding agencies that have endorsed the value of patient-public involvement in their grant funding schemes, and that was really the brainchild of the Chief Medical Officer, Dame Sally Davies, so right to the very top of the UK medical profession as someone who saw the benefit of patient involvement, and that she was able to then make that happen by becoming compulsory within all the grant funding schemes, and then that has snowballed again to research councils and charities taking on that board. And really the mantra there is that there's no research without us, and that also that you can get a huge impact of the research maximising patient benefit if you involve, and it's not tokenistic, it's true involvement. So perhaps one of the ways that Germany or Austria or Poland might tackle this is recognising that they can't change the culture necessarily by suddenly making people work cooperatively with pharma, but maybe they can actually have more impact by trying to work with their grant funding schemes. So clearly what we want from our EMP is for it to be highly inclusive. There are governance codes in place, and Laura Kavanagh can disseminate those to us to help guide us and then be modified to each particular country's needs. strong involvement of patient organisations, and that they want to have patient public involvement in research central to their organisations. Creation of a sound and effective scientific board, an academy of patients may be linked to the EU Forum, the need for effective communication channels, being progressive, aimed to raise standards and equip the patient organisations to have a stronger voice through education. And the division of workloads might be possible from moving from the NLT to the platform stage. We have an extended team now, and so we can share the burden. And certainly with Italy, with its 9,000, they must be very well placed to do that. So that's something to aspire to. I think national endorsement that the Italians spoke about this morning with Silviana is really important role, and if we can try and get that coverage within our own national situations, that would be very helpful, and it might be involving health ministers. Developing strategic links and growing country networks, we looked at that there needed to be a vision, that someone's got to hold that vision and want to take it forward, and then they bring in other like-minded people that share that belief. There was a feeling that they did need to meet up so that they can continue to enthuse each other, and that there's an enthusiasm for that shared vision and evolution. It provides real practical benefits for the patients, and we gave an example of an inhaled insulin device that was generated without patient impact, but was so huge that you would have actually had to have a suitcase carting it along with you. And it would have been quite nice if pharma had engaged earlier to overcome that poor design, and that they would have benefited because they would have saved money in a poor design. So it's about giving some of these examples when it doesn't work out to demonstrate what you can achieve if you work in partnership. And then signposting people to the Involve website that's got a huge resource centre on the impact of patient public involvement that you can all access, and then hopefully convince your colleagues as to why we're doing it and why it's important. So why should we join up forces? We talked about the fact that we need to do knowledge transfer and sharing of best practice to enable informed decision-making for therapeutic development and treatment decision-making. Patients know best, and that should be something that we take forward as our champions, is that could be one of our phrases that we use to move our cause on in a commonality way. Making opportunities for improved medicines development, and being part of this paradigm shift of having patients actively involved in therapeutic innovation, and being proud of that, I think. Ensuring patient benefits are central to the research rationale. So what can EUPATI offer? I think the previous talk had gone into that very well, and we only managed to talk about it quite briefly. But we thought that there was great opportunities to embed the knowledge that we're generating and the partnership work that we can do, so that we embed that in undergraduate health professional learning, so that they learn very early on in their careers that there are benefits of sitting around the table with patients and hearing that unique perspective that we bring to the table. Providing students access to present their research to patient forums for feedback right when they start. They usually have final year projects that they need to do. Let's get them engaged early. And patients coming into discussion what it's like to live with their condition, so the medical students can get exposure to that, and also bring in pharma and researchers on the same day or in the same series of talks where they talk about research on specific areas that are linked to the patients that might be coming in to talk about their specific conditions. So what type of alliances can the EMPs make, and why is an EMP mechanism useful? So we thought stronger together was the approach, and there's opportunities to advance international research. There are joint venture opportunities of signposting via EUPATI, so that when patient experts are trained, they become the ambassadors acting as skilled partners, and with industry and academia working then accessing those ambassadors, they ensure that patient benefits are brought into the research and the research is maximised to deliver what patients want. How can we convince others about the added value of EUPATI? We're starting to run out of time now, so the answers are getting a bit shorter. So for patient organisations, it's about ensuring access to training that all the patient organisations want. And for academics and clinicians, it's ensuring raised knowledge and awareness of the patient public involvement contribution angle. And obviously in the UK, it's mandatory for a successful grant application And believe me, the patient public involvement reps that sit on the panels reviewing our grant applications can really tell when it's tokenistic, and it never gets through if it is. And then this is just a final suggested terminology that we've come across in the UK. We have lots of problems with patient public involvement representatives, and we're going to challenge that and maybe talk about patient public involvement contributors, because it avoids some of the barriers that we get in terms of lay persons and expert persons, and whether those are equal to bring to the table. But actually, everyone has a role to be able to contribute. So that's just my own personal take of something that could be useful to start to use as a terminology. So thank you.
Thank you very much, Sue. I would say this is almost a cookbook for establishing a new national platform in some of the countries where we are still lacking activities and the establishment of such. So thank you so much. That's been very helpful. Just as a side note, we are of course going to share all the slides because I've received that question, both the web streams as well as the PDFs of the presentations after the meeting. So you don't need to write everything down. You can download that on our website then later on. Okay, breakout group number 3. This is about making it work nationally for non-EUPATI countries, and probably just to explain what that means. I mean, like in any publicly funded project, you have constrained resources, and we had a very difficult discussion in 2011 when we founded this project that we needed to focus on 7 languages that are spoken in 12 countries. And so we focused initially on 12 countries, but of course many of you said, so what can we do in Romania, in Hungary, in Greece, and so on. And we had very difficult discussions in the EXCO, what we do in these countries, how we can support that without having resources and funding. And so this is a very important breakout group to discuss about how can we support these countries, how can we drive the discussion forward in the countries that are actually not part of our grant agreement in EUPATI. So Ingrid, President of the European Forum for Good Clinical Practice and co-leader of the Work Package 2, is going to present the outcome.
It was a Hercules task in an hour, because having whole Europe minus 12 covered practically in 17 countries present in the room with very different backgrounds and very different starting positions also in that aspect made it quite difficult to come to a clear picture of what we can do. But we tried, and I think we did as well as we could in this hour. So let's be clear to you, as we have just heard from Jan, it was really the problem that we have countries beside or outside the 12 countries where we have to deal with. We had to focus ourselves on the 12 national, 12 EUPATI countries, but we know that there are proactive, enthusiastic and very committed supporters in driving patient involvement in their country out there. And of course, we see this huge opportunity, and we really have these very difficult internal discussions how to best facilitate but also utilize this potential for our overall goal of patient empowerment through better education in Europe. So what we tried in this breakout group under the leadership of Tanja Kuiper from Merck Serono was the objective to identify which steps individual supporters of EUPATI can take in countries where we have no ENP or where it's not foreseen, and to clarify for supporters in such a country which support is available from EUPATI, at least at the moment. So it was, as you can see, we had 17 countries in the room, with people, of course, in these countries from different backgrounds, so seeing their perspective to that whole story. And so when we started with the question, why do you want to install EUPATI in your country? What are the drivers, your rationale, your goals? And one very clear agreement, I would say, was that patients need to get more and correct information, learn where to find it and how. So this need for objective, good, reliable information is extremely important, and this is a lot of very different type of information that is required. Patients need to understand their role in research as participant and advisor. that is something that we have also heard from several people, that this is something that still needs to be done. Patients need to understand their role that they can have, and not just as participant in a trial, but really overall in the process. And there is also practically in all countries a need for a joint language, a language between the three stakeholder groups. They talk different languages, they have a different way of expressing themselves, and the fundamental basis is that there is a development of a joint language, and EUPATI being a public-private partnership living this collaboration and this common talking. And we also in EUPATI, we needed quite some time to talk the same language. It was not easy. But this is an example that can be used and that can be helpful in the different countries, and it's required in all countries to achieve that. There needs to be improved awareness and understanding of the relevance of treatment instructions. Also there we had obviously quite big differences, and the idea was that if patients know better how treatments are developed, what the relevant elements of treatments are and that they work, this should be improved through better knowledge, and then also that there is a real need for increased respect for patients as partners in the other stakeholder groups. And by bringing EUPATI into a country, it was thought that this would definitely help. So expectations from EUPATI organization would be that we make better information, or better information will make expectations of the stakeholders more realistic, because that's the other problem. We need to manage expectations. Empowerment will not just come out like that, but it has to be worked on. Information and dissemination of information needs to work over time. So we need to manage the stakeholders' expectations and make them more realistic and more patient in many aspects, as we have learned in EUPATI. Information provided by EUPATI is and remains absolutely credible. That was seen as a very, very important fundamental requirement that we need to achieve, and we all work very hard, but that is also, of course, then a difficulty when information is handed over into a country. What's happening there? How is that managed? How is that further developed? How is that used? And it's really a responsibility of an organization to make sure that this is done in the most professional way and reliable way. So the next question that we asked was, what would you need from EUPATI to support your activities very concretely in your country? And there were very concrete questions like, could we have a letter of intent or a letter of introduction to give to academia, other stakeholders? And of course it is possible. It's a matter of talking to us. There is Laura, there is myself, there is Ilaria, there is Ingrid Heine. So there are people that you can approach, and then we will enable that. There was also the question whether there is a possibility to have EUPATI speakers here from the core team in national events. Of course, just talk to us and we will help to find the right person. If you need a patient representative, if you need somebody from academia, if you need somebody from industry, we can help you to enable that. Then what definitely is available is presentations on EUPATI. We have it on the website, but you can also, if you need a more tailored one, we have made already so many different presentations on EUPATI. We can probably give you for every topic more or less a proposal. But then also very importantly, support in getting the competent authorities, HTH agencies, ministries of health, etc. involved. And I think from the experience in the last 3 years, we are able to do that. We have experience, we have collaboration now with several competent authorities, and the competent authorities in Europe speak to each other, the national competent authorities. So if it's possible in several countries, there is certainly also a possibility to help establishing that idea and openness for collaboration in other countries as well. Another topic was that the toolkit should be earlier than later available. Everybody seems to be urgently waiting for it. We need, and that was a difficult discussion, we need to have a clarification of the issue of representativeness. Well, that is something that is obviously creating confusion. We also in EUPATI ourselves, we have not completely found an easy answer on that, but I think we really need to work on this. And also concerning conflict of interest rules, how to argue when somebody comes and says, yeah, but you are working with industry, how to explain that, how to make sure that the conflict of interest, also when supporting or when participating in an ethics committee or in another advisory body, that this conflict of interest is made clearly defined, how the rules are and what the prerequisites are here. Next question was, which hurdles do you foresee in implementing EUPATI on a national level? And there we had clear messages like patients are not yet influential in my country, so we have still a long way to go to get the acceptance. There are still substantial gaps in reality between patients and industry. But also then practical things like it will be not so easy to organize the translations that are really right, good quality, correct, really fulfill the, let's say, the quality notion and requirements of EUPATI. That's not so trivial, especially if there's no money. And that leads automatically to the question how to get budget, how to get money, because this is fundamental. These countries have absolutely no seeding money. They need to think about getting the money from the beginning. Need for an organization who can sign a contract with industry or with a public organization for public funding, and also being able to open a bank account. And also, coming back to the translations again, a recommendation on how to organize the translation process when there is not an established infrastructure yet. How could we overcome or help to overcome these different national obstacles? There was the topic of helping to establish more professional patient representatives and the understanding of the relevance of a patient key opinion leader. That is perhaps also something that we should establish as an idea, that key opinion leaders are not only academics, but also patients, and that they have an equal amount of relevance when giving advice. We are nearly through. How could non-EUPATI countries learn from each other and cooperate effectively? Now, one topic was again how to collaborate with the competent authorities, that they could learn from each other there. Also, how to achieve public funding. What options are out there? There was the question about an EUPATI 2 in IMI 2 that is not going to happen as such directly, smoothly following. So we are talking about sustainability overall, and we will hear about that. But we need to also in the countries make sure that we get access to public funding, and there are different ways and different opportunities that we can help each other to better understand. And then the idea was also discussed that it would be helpful to do a type of twinning strategy. So twinning a country with an established network with a country that would like to have an ENP, or one of the countries that are not the EUPATI countries. There is experience in such collaboration when before the CEE countries joined the European Union. That has worked very well, this twinning concept. And so the question is whether it would not make sense that countries that are not an EUPATI country look for one of the EUPATI countries with an ENP that have comparable conditions for establishment of a platform, and then to figure out whether you could not really establish this type of collaboration. And well, the last question was also answered only in fact, at the very beginning. How would you enable sustainability? As these are non-EUPATI countries, they need to think about sustainability from day one, as they have no seed money from EUPATI at all. So this topic was not yet the most important one in this group. Thank you very much.
Thank you so much, Ingrid. I think we can learn a lot from what you discussed in that group, and I'm sure that will be discussed also tomorrow in the meeting of the national platforms, and important input for us. For the last session, I mean, Ingrid mentioned that we are discussing a lot about sustainability because the current funding of this project will run until end of 2016 or January 2017. And so thinking ahead is already a topic for us today. And the session 4 was actually thinking about keeping it going over the long term, how to make EUPATI a long-lasting success, which is an important topic. And Per from the University of Copenhagen, from BioPeople, is going to report what you discussed. So stage is yours.
And in the interest of time, I will do a little bit truncated this one. But I would also say that in Denmark, we don't have a national platform formally established. And if we're going to the twin partners, I think I would look at Toscana in Italy for that. So let me put it brief then. Our group looked at the longer-term perspective of EUPATI. And that's, of course, a difficult theme, but we thought that in the group that the time is now ready to share national experience and also to share best practices, and also that the next future will be with a lot of EUPATI deliverables and actual material, training material, the toolboxes, and also the web wiki material, and the trainer-trainer opportunities that's coming out of the face-to-face and the certificate program. So the time is right now actually to look at the long-term perspectives in this, and also to share experiences and to share best practices as going forward. We looked at it at two dimensions, one micro dimension and another macro dimension in the approach to long-term considerations. For the micro, and it means more on the country-like, what you have close to each of the countries, engagement of local stakeholders is an important issue, and also the formal structure of the platform, as we also learned from our Italian friends. A concept paper could be useful in terms of driving the national platform and also as a basis for promotion and funding. I can talk more to funding if time allows. Transparency in the process is important, and also activities and events are important for driving communication and visibility and establishing the network. Communication is very important as part of that, and can be also seen as part of activities and events. For communication, there are various options. There was one voice saying that including young people is important in this process. And also there's an option in communication on a national level to use the participating institutions in the platform. And then, of course, social media is a very important communication channel today. Challenges are many, but challenges are to be overcome. And I think from each of the countries there can be a list of challenges that can be managed in the way you manage challenges. On the macro level, if you raise EUPATI up here, I think the voice from the group was that EUPATI provides access to information and tools. It is credibility is a very strong value proposition from EUPATI in going forward. It's training and it's training material. Impacting is important for EUPATI. And there was some voices to say that that's an opportunity to link EUPATI into European decision making on a higher level, the macro level, for example, within the Commission or the European Medicines Agency or other European institutions. Collaboration was thought very important for going forward. Collaboration between all the stakeholders, and the collaboration and the model of collaboration is going to be expanded. And again, for the macro level, there are challenges out there, but the challenges are also opportunities and possible strength for what we're doing in the paradigm shift of healthcare. Patient leadership as voice in decision-making is important for the future system. And now if we reverse the macro system to the micro system, then actually activities on the national level is actually facilitating what's going on the common European level. So I think that was the end note from Group 4. Thank you.
Thank you so much, Pierre. I mean, we are perfectly on time at 1:45, but still we started 10 minutes late, so I don't want to waste the opportunity to give you the chance to ask questions to any of the four, maximum for 5 minutes, and then we are going to move on. So are there any burning questions you have to any of the four group rapporteurs? This is not the case. So you've been very clear. Thank you so much. So I'd like to introduce the